And as the White House continues to mitigate the spread of coronavirus in the U.S., there is such a thing as doing too much. That's according to One America's Chanel Rion, who has this report from Washington.
You've heard the phrase dozens of times by now, be it from media, the White House, or medical professionals.
But we are making progress to flatten the curve.
Flattening the curve
is a challenge. And the challenge is we still have the opportunity to influence the course of that curve. So what we would like to see is that when this is all over, our curve was not like that. Our curve was like this.
In other words, slowing down the rate of infection so that medical capacity is not overwhelmed. The Trump administration is flattening the curve by urging Americans to follow CDC guidelines, stay home if sick, social distancing, hand washing, shielding the elderly. Some states are taking more extreme measures. We are joined by surgeon and state representative Dr. Rick Becker of North Dakota. Dr. Becker, not only do you say governments should be careful about being too heavy-handed flattening this curve, you also warn reactionary policies can make this virus last longer than it should?
So government officials have to find that happy medium. Where can we bring the rate of transmission below the threshold of medical capacity, but not so much further? That is going to harm the economy and take away our civil liberties.
Dr. Becker uses 3 graphs to demonstrate. The high curve is what happens if no actions are taken and people are infected at a rate that exceeds medical capacity. The middle graph shows a moderate flattening of the curve, and the low graph shows an intensive flattening. The more intervention takes place, says Dr. Becker, the longer the virus drags out.
We're just talking about delaying the rate of transmission, slowing it down. We're not talking about fewer people getting sick. I think that's the common misperception. It's like, it sounds really good because I don't want to get sick. Well, no, that's not what they're talking about. They're expecting the same number of people to get sick, just more slowly, so that we don't exceed capacity. So that's why we want to bring it below medical capacity, because we don't want people to die because there wasn't enough ventilators. Okay, I have no problem with that. But just to be doing it without a reasoned approach to flatten the curve at all costs is wrong.
From a medical perspective, are we overreacting to this virus?
I think there is a strong impetus to inflame this whole situation and to bring about a perceived intensity in the crisis. If you have a 20-year-old and 10 80-year-olds hospitalized, the median age is about 50, I think. So that's going to scare people like, wow, that sounds really bad. But the mean age for the 120-year-old and the 10 80-year-olds, the mean age is really what people relate to, is 75. That's the average age. But people don't want to report numbers that are going to reassure the public. They want to report numbers that are going to cause fear and panic in the public. Why? I don't know. I guess it drives news, and it might drive political agendas.
The administration is looking to reopen the American economy, possibly by the end of the 15-day period. Is America ready?
Each state needs to look at things with regard to their own situation. There's not necessarily going to be a one-size-fits-all. However, the general concept of the 2-week sort of physical separation or shelter in place should be enough to have slowed the curve down. And I think it is reasonable to allow people to get back to life, to reopen business, to let the economy start going.
Dr. Becker, what about reopening schools? Do you recommend it?
Let kids go back to school. Kids really, in large part, aren't getting sick anyway. Again, if we focus on reducing transmission by common sense things like washing our hands, and if we really, and we should, we really need to protect the elderly, the immunocompromised, and people with pulmonary disease. They must be protected. We have to do everything to keep them from getting the disease. But for the rest of us, it's going to come through. It's going to come through society anyway. So why burn down the economy in the process of trying to prevent something that you're not actually preventing?
So if the administration opens the economy March 31st, would you view this as a responsible decision?
For the most part, I think the answer is yes. We need to get people back to their normal lives, get America back and rolling, get the economy booming. This government itself is going to be causing far more damage to America by its reaction to the coronavirus than the coronavirus itself.
Dr. Becker, thank you for your input. We look forward to having you back.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.